Welcome and good day to wherever you might be at whatever time you might be. And welcome to I'm not sure what number, but we are in the continuing global forum on nicotine. And of course, this is a very challenging time for all of us, given the COVID-19 pandemic, and perhaps even more so for the US, although there's been a significant global response to the recent police violence in the US. So again, just emphasizing the challenges that we're facing. Complementing the science track involved in tobacco and nicotine research, there's an obvious need to view and consider the significant need for advocacy and the pursuit of progressive policy, as well as practices both positive and unfortunately detrimental in the pursuit of harm reduction in tobacco use. Our speakers today indirectly are mirroring the recent global events, as both the COVID-19 pandemic as well as the Black Lives Matter issue in the US reveals the fissures and the inequitable status and impact on poor global communities. The harms of tobacco use are given and well documented. As we progress and face the challenges in tobacco harm reduction, we are additionally challenged by the fact that combustible tobacco use disproportionately affects lower income countries and lower income individuals in the higher income countries. Where my work is focused, persons challenged by substance use and mental health disorders are clearly the most impacted. Hence, directly and indirectly, our speakers on this panel today are addressing these issues. Our first speaker, Alex Wodek, is a retired physician. He is currently the president of the Australian Drug Law Reform Foundation, and he's worked full-time on drug law reform as a volunteer. With colleagues, Dr. Wodek started the first needle syringe program in 1986 and the first medically supervised injection facility in 1999 in Australia, when both were not legal activities. Dr. Wodek has also been the president of the International Harm Reduction Association from 1996 to 2004, and more recently has been involved with tobacco harm reduction. I hope that you'll find and appreciate the importance of Dr. Wodek's presentation on the cost effectiveness of harm reduction as he documents the financial, the health, the social, and the productivity offset of harm reduction efforts in needle exchange, safe injection facilities, HIV, Hep C, sexuality, alcohol use, and of course, all of which has relevance and application to tobacco harm reduction. However, in looking at the cost effectiveness, we often know that policy is not often based on science or rationality. Our next speaker is Spike Bababian. Spike has been an adjunct faculty in New York City. She's been using e-cigarettes since 2008. She founded the first consumer group for vapors in 2009, co-authored the first peer-reviewed paper in the US on vapor toxicity. In 2011, she opened Vape New York, the first vape shop, which has now grown to 4 locations. She has had day-to-day contact with tens of thousands of vapors, consulted with many politicians, researchers, media outlets, and government bodies regarding e-cigarettes for more than 10 years to educate academia, scientists, and the public on vapor product use and safety. Her presentation today focuses on the role of the vape shop as a health resource in the way of educating, advocating, providing important information and support to individuals who are exploring and on their journey to switching to much less harmful nicotine use. Clearly, many vape shops are providing a resource which is sorely lacking even in conventional tobacco intervention smoking cessation programs globally. What I'm also aware is that Spike's effort in her commitment and understanding of low-income communities in New York, where she has made also a commitment to those populations. Her presentation will be followed by Dr. Shri Sugarita, who is a physician and professor in the Department of Community Medicine, Tagore Medical College in Chennai, India. She's also had a fellowship in HIV medicine. She undertook a web-based survey among ENDS users in India, and current projects include tobacco prevention, control, cessation support services for migrant construction site workers. She will be talking about and focusing on this vulnerable and other vulnerable population, the migrant worker involved in construction in the state of Tamil Nadu in southern India. Dr. Sagaritis outlined the dynamics, the epidemiology, the need for access, and last but not least, the political and structural barriers in reducing tobacco harms in this population. I would add editorially, in addition to the political and policy barriers, that it will be increasingly important to consider globally how global populations in lower income communities will access the evolving alternative nicotine supply market. Who, I would ask, will take on this effort? Our final speaker is Chimwewe Ngoma. He is a social scientist, tobacco harm reduction advocate, and project manager for Tobacco Harm Reduction Malawi. He has worked as a content writer in Solomar International and also worked as a project officer at Drug Fight Malawi. Mr. Ngoma's presentation will focus and address the significant challenges of tobacco use in the context of tobacco-driven and dependent economies such as Malawi, and he'll begin to talk about the importance of facilitating crop diversification, as well as harvesting the use of nicotine from existing tobacco plants for safer product use. So I hope you derive a lot from these presentations today, and I wish you the best to stay safe and healthy. Thank you.